Hello, my name is Richard Moore, and I am here to talk to you today about deaf and hard of hearing people and the hardships or difficulties that they may have with exercise, some of the things that go into the diagnosis and treatment of people who are deaf and hard of hearing, and some of the things that we may do for them, maybe to make their lives just a little bit easier. So, obviously, I'm sure a lot of us have a good idea, but just to be specific, like what is deafness and hard of hearing? Normal hearing would be described as falling around 20 decibels, which is about the sound of a mosquito buzzing. So if you can hear the mosquito, you have about normal hearing. A person with less than that is said to have hearing loss, and people who are hard of hearing have a more mild or severe loss of hearing, but still normally communicate through spoken language. They may also still benefit from hearing devices like hearing aids. Deaf people have little to no hearing at all, can benefit from cochlear implants, and more often and will use sign language. Um, Moving forward, we will look at the different degrees of hearing loss. So if you look to the left of the screen, you will see mild, where you can hear most speech sounds but struggle to hear soft sounds. Getting closer to the source or turning up the volume helps you hear better. Then we move up to moderate, where you find it difficult to understand people talking to you at a normal volume, and you may miss quiet sounds like rain falling or something as simple as coffee brewing. Then we move on to higher levels like severe, where you hear little to no speech when people are speaking at a normal level. Even with hearing aids, speech may be difficult to understand, and you likely only hear loud sounds. And at the top, we will see profound, which is when you struggle to hear even loud sounds, such as fire alarms and airplane engines. You likely only hear extremely loud noises, and speech is completely inaudible. So, here are some of our causes of deafness and hearing impairment. Genetic hearing loss accounts for 50% of all cases. This will be something in your DNA that just occurs when you are born. This accounts for half of all hearing loss cases. Hearing loss is the most common sensory system disorder, whether like among the five different senses. Hearing loss can result from inner ear damage, aging, or loud noise, which wear down cochlear hair cells and nerves, reducing sound signal transmission. High pitched tones may seem muffled, and background noises can often seem harder to understand. Other causes include earwax buildup, which is a temporary thing, ear infections, also temporary, unless not treated, if severe enough, abnormal bone growths, tumors, pressure changes, injury, whether that be traumatic head injury or from the sound, or again, infection. So, how would we go about diagnosing this? A healthcare provider is, whether it be your general doctor, you'll meet with them and you'll talk to them about symptoms that you may feel that you are experiencing. They will check for infections or any injuries or damage or things that they may feel have caused loss of hearing. And after this, if they feel that there is steps to be taken, they will refer you to an audiologist. An audiologist may perform more specific testing, including pure tone testing. Some of us may remember a partial version of this when we were kids, wearing the headphones and raising our hands for the different sounds. So you wear headphones to hear sounds and speech, and you'll wear devices on your head for bone conduction testing. And a combination of these two things will help an audiologist determine which type of hearing loss you have. And then you have an autoacoustic emissions test, or an OAE, where an audiologist uses the test to check your inner ear function. And you have tympanometry. This checks how well your eardrum moves. Audiologists may do tympanometry tests to see if you have a ruptured eardrum, fluid in your middle ear, or wax in your ear canal. Here is how often we may have someone be tested for hearing issues. This is without being symptomatic. If symptomatic, obviously you go out of your way to go see a doctor, describe your symptoms, and go over the things that we just talked about here. So we see newborn hearing screening, which is just testing to see, reactionary, just if the newborn reacts to sounds. We see it in children and young school, which, like I discussed before, we all remember wearing the headphones with the loud little beep. We have hearing screenings in adults with high risk occupations where they need to hear things and uh, need to make sure that they can hear soft sounds just like that. And then, of course, we have our older population when our hearing starts to diminish, where regular hearing screening is recommended to prevent safety hazards. So treatments. I talked about earlier that one of them that is temporary is earwax. Removing earwax can help alleviate some of issues. Earwax can cause a blockage leading to hearing loss. That can be fixed by the doctor with one of the devices that goes in and sucks the earwax out, or they can take a hooked tool and scrape the earwax out. Another thing would be surgery. Some hearing loss conditions can be treated surgically. Obviously, I'm sure many people have heard of hearing aids, which, if there's damage to the inner ear, may cause the doctor to recommend a hearing aid, which helps to amplify the sound and direct it where it needs to go to hear it better. And then we have a cochlear implant, which is different from a hearing aid, whereas it doesn't just make sound stronger, but it goes around the actual inner ear to spur the nerve itself to create the audio. How does deafness or hard of hearing affect the exercise response? So, from what we know, hearing loss normally does not modify the exercise response or any form of activity. Many individuals can participate in high intensity exercise or sport without special accommodations. Of course, they will have their things like their hearing aids or their cochlears, but most will not need full special accommodations. While they don't differ drastically, both children and adults who have some form of hearing impairments tend to report higher amounts of overweight or obesity compared to those without hearing impairments. This can be due to social anxiety or fear of participation due to the fact of having their hearing issues and feeling like that may be a barrier for them. So that's where brings me on to my next point of participation in sport and exercise. Studies show that participation in sports raises the self-esteem of deaf and hard of hearing people. This improves the person's experience and quality of life. And another huge impact of sport and exercise is the social impact that comes from playing or participating on a team. I'm sure many of us who have participated in a sport can think back to a team, maybe just a group in one of our classes where you met someone, you became close friends, or even just genuine, regular friends, and you're still friends with that person to that day. And that's a huge part of why sports are such a great thing for people socially. They can create social connections, which are incredibly important for people with hearing loss. So the case study that I have is a patient. His name is Eric Richards. He's 59. He is hard of hearing in both ears due to long-term loud noise exposure without proper earwear. He has a medical history of borderline hypertension, but he is treating that with beta blockers. He is partially active in his daily life, but he does not meet the rule of threes. And if you ask me if I feel that Mr. Richards would need clearance, I would like Mr. Richards to get clearance before engaging in vigorous exercise before we get started to make sure we are monitoring his blood pressure. This is just to make sure that there is no adverse effects from him being on his beta blockers, nothing weird, just making sure that everything goes right. So we'll have him see his main physician and his cardiologist. His goals are to improve cardio health, enhance balance and coordination, and reduce stress and anxiety, which comes from a little bit of a lack of his exercise as he's gotten into his older age. The exercise testing that we will be using, we will go over uh, 5 different tests and just a short little why for each of them. So our aerobic test will be the 6-minute walk test. This is a safe test for Mr. Richards that will also measure his endurance. For a resistance test, we can either use a hand grip dynamometer or we can do a 10 rep max, as this is will assess strength and it's safer than say doing like a 1 to 3 rep max. We will go over his flexibility by doing a sit and reach test. This will help us identify his low body flexibility, see what type of score he gets, how many inches he's able to reach down. For balance, we can look at a tandem stance, having him stand 1 foot in front of the other, and this will help us look at his stability. And then finally, we will look at his neuromotor, which is just a timed up and go, so we may monitor his movement control. For an exercise prescription, here are 4 different parts of his prescription that we would look at, and we would look at him incorporating into his days how he sees fit. Obviously, for aerobic exercise, we'll look at 3 to 5 days a week, 40 to 60% of his resting heart rate, a RPE of 12 to 14, or heart rate reserve. My apologies. For time of the aerobic portion of his exercise, we're looking for 30 to 45 minutes of cycling, swimming, or fast walking. For his strength training, we will look for 2 to 3 days a week. This can be on same days as his other training days. We will be going at an intensity of 60 to 75% of his 1 rep max, about 40 to 60 minutes shrinking if this seems to be too much. And we will stick to compound movements like squat, bench, deadlift, and of course we will begin to incorporate other quality movements, maybe Olympic type movements if he's feeling more limber and athletic. We will go over his flexibility training. Speaking of limber, this will be a daily occurrence. This is very important. This will help him feel much better going through the movements of his exercises. His intensity will be just holding until there's mild discomfort, and this will be about 20 to 30 seconds per stretch, about 2 to 3 times. We will do yoga stretches and different static stretches. For balance training, this will be 3 to 4 times a week, and we would like to progress the difficulty anytime it gets easy. So each day that this is done, we would like 10 to 15 minutes, whether that's single leg stances, tandem stances, or even backwards walking, which can be dangerous and should be done with help if required, but in time will become much easier. Precautions or considerations. Environmental awareness. Avoiding high traffic areas due to the reduced hearing. If I were to send Mr. Richards out on a run, I would not have him do it in a high traffic area. We would do it in an area where it would be much safer for him. When participating with instructors, things like hand signals or visual cues should be used or created. So if I'm trying to give him a cue or something, I will not try to verbally communicate it. I will do a hand signal that we would maybe have created before we started. In this case, we want to monitor heart rate and blood pressure due to Mr. Richards being on beta blockers. Deafness and hard of hearing are not just about hearing loss. They can impact balance, communication, and mental well-being. Communication barriers in fitness settings can lead to reduced participation in exercise programs. Encouraging participation in structured exercise programs can significantly improve quality of life, independence, and a confidence in hard of hearing individuals. Adaptability is key. Programs for people who are deaf or hard of hearing should be personalized to accommodate each individual's needs, as although many of the people we will see will be hard of hearing, all will be at different levels for different reasons, and we need to take each individual needs into accommodation. These are just some of my references. I thank you for listening, and I hope you were able to take away helpful things when it comes to deafness and hard of hearing. Thank you.